So what does a veterinary nurse do? This will vary depending on the type of practice you're working in, as they are all very different, such as the workloads, site, type of cases, type of species that are treated. In general practice, it is the RVN's job to prepare patients for their procedure, and this often includes assisting the veterinary surgeon, monitoring anaesthetic, clipping the patient's fur, cleaning the skin and supporting them through their surgery. A major role of an RVN is monitoring the patient's anaesthetic, which may seem scary, but with training and plenty of experience, it really isn't scary and it is very interesting, and each case is different. An RVN can also perform minor surgery. This can include procedures such as minor rash removals from the skin and stitching the skin back up. Another role of the RVN is the monitoring of patients after their anaesthetic and making sure they are recovering as expected before they discharge. Pharmacy work is a role of the RVN, and this can include prescribing certain types of medicines such as preventative health care, and this can include flea and worm treatment, putting up medicines ready to be collected by the clients, and general stock control and ordering. Reception work is another important role. It helps to create client relationships from the moment they walk into the practice, and this may include general reception duties such as booking appointments, answering the phone and taking payments. Nursing consultations can be quite varied, which is always interesting. It can include simple appointments such as weight check of an overweight Labrador or something more complex such as nail clipping a bearded dragon. Other nursing consultations include second vaccinations, flea and worm checks, behaviour, nutrition, geriatric checks, and the list is endless. Having good people skills is essential in this role, as it helps to create bonds with clients and it keeps them coming back to the practice for many years. Wards is a very varied role of the RVN, and this may include taking patients recovering from anaesthetic surgery, as mentioned earlier, or caring for medical patients. This may include diabetic patients with diarrhoea, patients with infectious diseases, liver disease, kidney disease, heart failure, again the list is endless. It is extremely varied and a hands-on nursing role, and it always includes working with lots of medical devices such as fluid therapy and making sure patients are on their drip, and maintain feeding tubes to ensure patients are gaining essential nutrition during recovery and wound drains. A small number of RVNs work in large animal and equine sector. This can be very different to life in a small animal practice, as the patient's requirements are very different. This may include travelling out to work on farms with a veterinary surgeon, or you could be based in a mixed animal practice which treats both small and large animals, including equine. Equine nursing is becoming more popular, and this includes diagnostic imaging and lab work, preparing them for nerve and joint blocks, lameness investigations, assisting with artificial insemination, productive medicine, inpatient care, communicating with clients, and preventative health care. The classic uniform of the RVN is bottle green with white stripes on the end of the sleeves and usually on the collar. Just think of a human nurse's uniform, but we wear green instead. The classic uniform of a qualified and registered veterinary nurse is the uniform on the left. Student veterinary nurses, on the other hand, wear a similar style uniform but different coloured tunics. They will often wear bottle green trousers with a striped tunic which you can see on the right. The tunic is white with green stripes which does stand out. Sometimes the student uniform will have the word student embroidered into their uniform too. These are the classic examples of veterinary nursing uniforms, but it can vary depending on the type of practice you work in. Some practices have a standard uniform which can be a completely different style or colour. Regardless of where you work, a name badge or embroidery should be visible to clients to show them who you are and what you do within the practice. The role of a veterinary nurse includes customer service, providing expert nursing care, working as part of a team, and providing advice and support. Now take a few minutes to think about the skills that are needed to do this job. A vocational route is the traditional way into a career as a registered veterinary nurse. As you can see, the entrance requirements are lower than a higher education route, and that is because it is a level 3 qualification. The qualification can take up to 2 years to complete, and colleges offer these courses across the UK. This route is incredibly practical and would suit people who learn best in a practical setting environment. Although it varies from college to college, studying is usually done on a day or block release basis. For day release, 1 day a week is spent in college and the other 4 days are spent working in practice. For block release, you can expect to spend a week or part of a week in college and then several weeks at a time in a practice. This time spent in practice allows you to build experience, use the knowledge learnt while studying at college, and complete the learning progress log. The main benefit of this route is that you can earn while you learn, as you are employed by a training practice. Certain practices may also contribute towards the cost or completely fund your training, but this varies from practice to practice, so it is well worth doing some research first. One of the downsides of employment with a veterinary practice is you may be expected to work evenings, weekends and bank holidays, but this is all good practice for life as a registered veterinary nurse. As you can see, with the higher education route, the entrance requirements are a little higher than vocational routes. The higher education route can include a foundation degree to give you a level 5 qualification, or a Bachelor of Science degree, which would give you a level 6 qualification. The courses are studied at university establishments across the UK, and some colleges will offer the foundation degree. This training route takes between 3 and 4 years to complete, so it is roughly double the time of a vocational route. If you are interested in a higher education route, the training duration should not put you off, as there are many other things to consider. For example, if you prefer classroom-based learning as opposed to work-based learning, if you want the university life experience, and if you want a degree which may open up further opportunities, such as teaching and research. Many degree courses also offer optional modules later on in the course, including equine, farm and rehabilitation, but this will vary from university to university. The entrance requirements vary depending on the university, so you will need to check and do some research on individual university websites to find out exactly what it is you need to achieve before you apply. Each course may also be slightly different. Some veterinary nursing degrees include additional aspects such as animal companion behaviour and rehabilitation. As most of the time spent training is spent at the university, time in practice is achieved through placements. Again, specific timings will vary. At least 1,800 hours must be spent in practice, gaining all of the practical skills required to qualify, and this is often achieved through a full placement year, which many degree courses do include. Have a look at these X-rays. Try to guess which animal is in each X-ray. By looking at these next sets of X-rays, can you guess what these animals have eaten? If you have any questions about college or university, you can ask us your questions on www.higherhorizons.co.uk/ask. And please visit the next slide to complete our evaluation form. Thank you for listening.